Hello, everyone. This project is a group effort from Colorado, Michigan, and Utah. The three of us are completing a community health nursing course. We decided to create this presentation all about heart disease. By the way, did you know that the worst time to have a heart attack is during a game of charades? We are all excited to teach you a little bit more about heart disease. This presentation will be broken up into three sections. First, I will cover what heart disease is. Second, my teammate will teach about heart disease prevention through nutrition. And third, my last teammate will teach about heart disease prevention through physical fitness. We hope that this presentation is useful, informative, and entertaining. The World Health Organization, or WHO, has been the leader in treating both communicable diseases such as the measles and non-communicable diseases such as heart disease since 1948. The WHO stated that heart disease is the #1 cause of death worldwide, killing a whopping 17.9 million people every single year. Interestingly, this means that heart disease kills almost the entire population of Utah, Colorado, and Michigan combined every year. The three states have a combined population of 18.8 million people. The WHO created and implemented the Global Hearts Initiative in 2016 in order to increase awareness and prevention of heart disease. The major goals of the Global Hearts Initiative are to 1. Decrease tobacco use and abuse, 2. Increase physical activity, 3. Reduce salt intake, and 4. Decrease trans fats from global food supply. Before talking about heart disease, it is important to have a basic idea of how the heart works. Our heart is by far the strongest muscle in our body. The heart is developed and starts beating at around 3 weeks gestation. That's right, the heart is beating before most women are sure they are even expecting a baby. It is very faint and usually is undetectable by a fetal heart Doppler, but it is there. By around week 6, a Doppler could pick up the heartbeat that makes every expectant parent's heart skip a beat. From the 3rd week of gestation through the rest of that person's life, the heart is continuously pumping blood, masterfully circulating it through the body. Without any action on our part, our heart continues to pump. It is truly fascinating and miraculous. Our hearts are a series of 4 chambers, 2 atrium at the top and 2 ventricles at the bottom. The right atrium collects blood from the rest of the body. This blood is low in oxygen. The blood is then pumped into the right ventricle, which is right below the atrium. It needs to be pumped from there into the lungs for oxygen and carbon dioxide exchange. The blood is then pumped from the lungs into the left atrium, down to the left ventricle, and pumped out through the aorta to the rest of the body. Right near the connection between the left ventricle and the aorta are 2 coronary arteries. Their job is to branch out and supply the heart with oxygen and nutrients it needs. Cardiovascular disease or heart disease is kind of an umbrella term referring to any heart-related problems. This includes 1. Blood vessel diseases such as peripheral artery disease, abdominal aortic aneurysm, or carotid artery disease. 2. Coronary artery disease, which supply blood to the heart. 3. Arrhythmias, which are connected to the heart's electrical system. And 4. Congenital heart diseases. These are malformations in utero that are sometimes unknown and mild, or are severe and could require surgical intervention. The focus of this presentation is on blood vessel and coronary artery diseases. Many of these diseases are caused by atherosclerosis, or a fatty plaque buildup in the blood vessels. As the plaque flows through the vessels, it can start to accumulate and clump. As it accumulates, more is able to accumulate, thus restricting blood flow in that area. As the blood flow is restricted, the heart has to work harder to continue to be able to pump sufficiently to meet the body's needs. As the disease continues, the blood vessels become stiff and thick, making blood flow even more difficult to your heart. There are 4 phases of atherosclerosis. The first phase is a very clear blood vessel, and then it continuously gets more and more plaquey buildup until the artery or vessel is almost completely occluded. It is good to be aware of what risk factors you have so that you can keep heart disease prevention on your radar. Being aware can facilitate positive changes in your life to slow or stop developing heart disease. There are many risk factors. These include age. Older people are more likely to develop heart disease, but they don't have to. Physical inactivity, unhealthy diet, high blood pressure or hypertension, high cholesterol, diabetes, smoking, stress, family history, and gender. Men are generally at greater risk. Knowing these risk factors can help us to decide to make positive changes in our lives. The symptoms of each type of heart disease are slightly different. I'm going to describe the symptoms of atherosclerotic heart disease since that is the most common and most preventable type of heart disease. We want to watch out for symptoms such as pain in your chest, upper back, jaw, neck, and upper abdomen, chest tightness, shortness of breath, and chest discomfort. Pain or numbness in the legs and arms can also be a symptom of atherosclerotic heart disease. Any of these symptoms, if not relieved, could be caused by the increased plaque buildup in the blood vessels in or around your heart or other blood vessels. It is important to see a medical professional about them. Unfortunately, the complications of cardiovascular heart disease can be grim and sometimes irreversible. Some complications include a heart attack, which is a blood clot causing decreased flow to the heart through the coronary arteries, stroke, which is where the arteries are narrowed that supply your brain with blood, causing brain tissue death, heart failure, where your heart isn't able to pump enough blood to meet your body's needs, aneurysm, which is a weakened bulge in a blood vessel that can burst. If the vessel bursts, immediate surgery is needed to keep from bleeding to death internally. Or cardiac arrest, when the heart suddenly stops working. This is often caused by arrhythmias. Many of these complications can cause significant quality of life alterations and can sometimes be fatal. Fortunately, there is hope. Prevention is key to decreasing the chances of developing heart disease. The 2 best ways to prevent heart disease are through adequate nutrition to your body and plenty of physical activity. Is it time to make positive, healthy lifestyle changes in order to decrease our risk of developing heart disease?
Eating a heart-healthy diet can help to decrease the risk of heart disease. Creating a food plan can help keep you on track to eating the right foods. There are a couple different food plans that you can choose from. One is called DASH, which stands for Dietary Approaches to Stop Hypertension. The other food plan option is called a Mediterranean diet. Both food plans focus on eating more fruits, more vegetables, and more whole grains. Eating those types of foods can help to protect your heart. Being able to read labels is one of the most important things about eating a nutritious diet, but reading labels can be quite overwhelming, so it's important to know what to look for. So when you read labels, you want to avoid eating saturated and trans fats. So saturated fats and trans fats. A good goal is to keep your saturated fats to about 5 to 6% of your daily calories. You want to try to completely avoid trans fats. And labels often like to be tricky, as with everything in life, and give ingredients different names. If the label says it's hydrogenated or partially hydrogenated ingredients, that means it has trans fat in it and should also be avoided. Eating foods low in saturated fat, trans fat, and cholesterol will help to decrease plaque buildup in your arteries. If you think about water going through a pipe, the water goes through a pipe pretty nice and smooth. But when you have gunk and particles build up inside of those pipes, your water pressure increases and it's harder for that water to get through those pipes. And it's the same thing with your blood pressure. When you eat lots of fats and have high cholesterol, there's gunk and particles that build up inside your arteries and cause the pressure to increase, causing hypertension, high blood pressure, and can lead to other heart disease. You also want to try to avoid salt and sugar in your diet, and those things will also help to decrease your blood pressure and decrease your risk of heart disease. So you really want to try to read the labels and look at things that are low in saturated fats, low in trans fats, low in cholesterol. You want a lot of fiber. Fiber is good for you. Low salt and low sugar. So what are your sources of bad fat? So you've got saturated fat and trans fat. Some of the major foods that have saturated fat include red meat, full-fat dairy products, coconut and palm oils. Foods that have trans fat include deep-fried fast food, bakery types of foods like muffins, bread, donuts, cupcakes, all that delicious food. Prepackaged snack foods, margarines, crackers, chips, and cookies. It is good to include some saturated fats in your diet. You don't want to completely take them out, but they just need to be limited. The trans fats, however, should be completely eliminated from your diet, and it can be hard to do because it takes a lot of prep work and planning and lots of determination, but it can be done. Not all fat is bad. There are some good fats, and you want to make sure you include the good fats in your diet. Some of those good fats come from plant-based foods such as avocados, nuts, olives, and olive oil. Having these good fats in your body help to decrease your cholesterol levels and ultimately help you have a healthier heart. We talked about this a little bit earlier, but fruits and vegetables are really good to include in your diet. So you want to have good consumption of fruits and vegetables, and this actually decreases your risk of heart disease and can help to lower your blood pressure. You want to increase your fruit and vegetable intake by eating about 5 to 10 servings of fruits and vegetables every day. Eating a diet with lots of fruits and vegetables can also help to lower your cholesterol levels. Healthy meat. One of the best healthy meats you can eat and include in your diet is fish. So why is fish so good for you? Fish contains omega-3 fatty acids which help to decrease inflammation and cholesterol in your body. Eating fish twice a week helps to decrease your risk for heart disease and stroke because it decreases your cholesterol levels. The Mayo Clinic said this about fish. Quote, omega-3 fatty acids are a type of unsaturated fatty acid that may reduce inflammation throughout the body. Inflammation in your body can damage your blood vessels and lead to heart disease and strokes. Omega-3 fatty acids may decrease your triglycerides, lower blood pressure slightly, reduce blood clotting, decrease stroke and heart failure risk, and reduce irregular heartbeats, end quote. Some of the best fish you can eat is tuna, salmon, and lake trout because they have the highest amounts of omega-3 acids in them. Maintaining a healthy weight is part of your nutrition plan. Having a healthy weight can decrease your risk for heart disease. The best way to identify a healthy weight is honestly from your doctor. They can calculate your BMI, which is based off of your height and weight. However, this isn't very accurate. Muscle weighs more than fat, so a very muscular person is going to have a higher BMI. Doesn't necessarily mean that they're overweight. There's another way that you can measure a healthy weight limit, and doctors can do that by measuring your hips and your waist for a better measurement of excess fat. Men are considered overweight when their waist measures greater than 40 inches, and women are considered overweight when the waist measures greater than 35 inches. Special equipment can also be used to determine a person's excess body fat and hydration status. The Mayo Clinic said this, quote, even a small weight loss can be beneficial. Reducing your weight by just 3 to 5% can help decrease your triglycerides and blood sugar and reduce your risk for diabetes. Losing even more weight can help to lower your blood pressure and your blood cholesterol levels, end quote. Smoking. So pretty much bottom line is if you don't smoke, don't start. If you do smoke, you should quit. Quitting is not easy. However, it greatly reduces your risk of heart disease. So you should definitely talk to your doctor about options to help you quit smoking because it will completely help your heart and decreasing your risk of heart disease or helping you get better if you do have heart disease. Consumption of alcohol can be very damaging to your heart. Monitoring how much alcohol you drink is important for your diet. If you cannot eliminate alcohol from your diet completely, drink in moderation. A good guideline to follow for healthy adults is as follows. So women of all ages and men older than the age of 65 can have up to 1 drink every day. Men who are 65 and younger can have up to 2 drinks a day. The Mayo Clinic defined 1 drink as either 12 ounces of beer or 5 ounces of wine or 1.5 fluid ounces of 80 proof distilled spirits. Sleep. This is a great topic. I think everybody loves to sleep. However, I don't think people get nearly enough sleep. If you're like me, you dream of sleeping 10 hours a night, but it just doesn't happen. But not getting enough sleep is quite harmful for your body. A lack of sleep can actually increase your risk for multiple diseases, one of them being heart disease. Other ones include diabetes, depression, and obesity. The standard for most people need 7 to 9 hours of sleep every night. You should be able to wake up without an alarm and feel rested after you sleep through the night. If you have a difficulty waking up and are having a hard time getting out of bed and being productive, you probably need more sleep. Making sleep a priority is super important. So set a routine, wake up at the same time every day, go to sleep at the same time every day, sleep in dark, quiet rooms. All of those things can help you to sleep better at night. Stress. Everyone deals with stress. It's just part of life. But how you deal with stress can affect your health. It's important to establish healthy coping mechanisms. A lot of people, to deal with their stress, overeat, drink, smoke, as ways to cope with their stress, and all of those things can lead to heart disease. So finding good coping mechanisms is essential for having a healthy heart and a healthy mind. So some of these good coping mechanisms might include physical exercise, meditation, relaxation techniques, and just finding fun hobbies to do that you enjoy.
Science Rock Academy! Research written, performed, and edited by the students from the Nueva School.
I'm gonna tell you about the hearts, the heart structure and function.
Your cardio system is a series of tubes. Blood circulates in a figure-8 loop. Valves, veins, and arteries, and one big pump. Right ventricle sends blood to the pulmonary trunk. It's deoxygenated, so it's headed to the lungs. Gets oxygen, then it's to the left like Beyonce. Then oxygen-rich blood feeds every body part. Trade O2 for CO2, then come back to the heart. Travels through superior and inferior vena cava, then back to the right atrium, start it over. But don't forget, your heart is made of cells. It needs oxygen and blood just as well. What happens if it doesn't get that blood? What happens if it doesn't get that blood?
I've got a problem, it's called coronary heart disease. I can't pump the blood through my heart, it's too hard for me. Don't you see that I get blood clots in my arteries? I really need some help so I can start a beat. Let me tell you that my vessels can get filled with plaque, but sometimes it gets too big and it will start to crack. And that's what causes all of my heart attacks. My sight goes back and I need lots of help real fast.
I'm gonna tell you about the hearts, the heart structure and function.
You've got coronary heart disease, it blocks your blood so you can't breathe. Your beats are inconsistent, you could pass out in an instant. Plaque builds up in small canals and cracks and builds up all your blood. No oxygen can reach your heart, soon your beat is gonna halt. But you know it's not your fault, now you need a restart. An EKG can test your heart and see where damage has occurred. You're almost done with being cured, we'll give you drug therapy, preventing all those blood clots and breaking up your platelets. Aspirin, Brilinta, Effient, and Plavix, those are your remedies.
We solved my problem of coronary heart disease. I can pump the blood through my heart so easily. Don't you see that I had blood clots in my arteries? I really needed help so I could start a beat. Let me tell you that my vessels got filled with plaque, but sometimes it got too big and it would start to crack. And that's what caused all of my heart attacks. Now I'm healthy even after all of those setbacks.
Preventing heart disease through exercise. How does it help? We are frequently told how important it is to exercise, but why? What does it do for us? Exercise helps to burn calories, maintain a healthy body weight, lower blood pressure, and regulate blood sugar levels. It can also increase exercise tolerance, reduce LDLs and total cholesterol, which is bad cholesterol, and increase in good HDL cholesterol, as well as increase in insulin sensitivity, which may decrease the risk of diabetes. But when do I start exercising? This is a question a lot of people ask. It is never too late or too early to get your heart healthy. Many people will argue that they are too young to worry about heart disease or too old to prevent heart disease. It is never too late to start exercising to aid in the prevention of heart disease. What type of exercise is best? There are so many different types of exercises, so how are we supposed to know what is healthiest for us and our hearts? The best kind of exercise for your heart is aerobic activity. Any kind of activity that gets your heart rate up is going to be heart healthy. Some great examples include walking, swimming, light jogging, and biking. Aerobic exercise helps prevent heart disease, but it also helps to lower heart rate and lower blood pressure. It can also improve circulation and help cardiac output, which is how well your heart pumps. Aerobic exercise can also help to decrease the risks of type 2 diabetes. Ideally, you should work out 5 days a week and 30 minutes a day or 150 minutes per week of moderate activity. Resistance or strength training affects our bodies different than aerobic exercise. This type of exercise affects body composition more than that of aerobic exercise. Strength training can help reduce fat and create leaner muscle mass. Having high amounts of body fat is a risk factor for heart disease, so decreasing this body fat can help prevent heart disease. The combination of strength training and aerobic exercise can raise HDL, which is the good cholesterol, and lower LDL levels, which is the bad cholesterol levels. Strength training is best utilized doing this exercise 2 non-consecutive days per week. There are different types of strength training, which include free weights, weight machines, resistant bands, body resistant exercises like push-ups, squats, and chin-ups. Stretching and flexibility may not contribute as much to heart health as aerobic and strength training exercises. However, this type of exercise can help with musculoskeletal health. Joint pain, cramping, and other muscular issues can inhibit people from doing further workouts. It is important to help your body feel better and prevent heart disease as well. This type of exercise will assist in helping continue mobility in older age, so aerobic and strength training is a possibility. This type of exercise can help improve balance as well and may prevent small falls in the older adult. This type of exercise can be utilized every day, and stretching should be completed before and after other types of exercises. Different types of stretching can be learned from physical therapists, yoga, tai chi, and basic stretching. Many people ask the question, how do I start to exercise? It is important when you start to exercise, you start slowly and safely. If you have previous health concerns, you should talk to your provider and with their help, create a program that works for you and your current health goals. You should always warm up your body and stretch good to prevent injury. It is also important to cool down. You can perform the same exercise but at a slower pace for cool down. Patients at risk. For those that already have heart disease or currently have 2 or more risk factors, you should consult with your physician prior to beginning exercise. Risk factors include immediate family members with heart disease prior to age 55, cigarette smoking, high blood pressure, abnormal cholesterol levels, diabetes, sedentary lifestyle, or obesity. It is important to remember that you are trying to get healthier when you are exercising. Keep your health in mind and take rest periods. If you start to feel any chest pain, stop and call your provider or 911. If the weather is hot, avoid overheating by exercising in the morning or evening. If it is cold, bundle up and cover your nose and mouth when outside. In the graph, it shows those adults that are least fit have a mortality rate that is 4.5 times higher than those of the most fit. An individual's fitness level was a more important predictor of death than established risk factors such as high blood pressure, high cholesterol, diabetes, and smoking. Exercising is hard, and so it's important to find the right motivation. Put on workout clothes. Write down how you feel after every workout. Why do you start? Remember that. Ask yourself, will I regret skipping this workout? And sign up for classes so you can do group workouts. Other ways you can motivate yourself is encourage others. Try group fitness. Surround yourself with motivation. Challenge yourself, both long-term and short-term goals. Surround yourself with people that support you.
We hope that each of you has learned something new today, either about heart disease itself or how to better prevent developing heart disease. We have created a brochure that has a summary of what this presentation covered. Thank you for watching.